Good morning from Boston. It's a sunny and bright day. Welcome to the 16th edition of USAIC's Biopharma and Healthcare Summit. It requires literally a village to put this kind of event together. Just an example, it took for the polling about 5 iterations and edits before you could have the 7 polling questions. Our colleagues in the bioscience team must be thinking, hey, what these guys are up to. It's a simple thing like polling questions. But I must tell everybody pitches in. We take this task very seriously. Each panel is all well thought of. Everybody from startup CEOs to the big pharma, investors, academic colleagues, they pitched in to give their advice how best we can put these panels together. So each panel, I would say, has been crafted by real global experts over there. And we strongly feel personally that when good people come together, good things happen. So please enjoy the benefit of this annual summit. And I must welcome all the students. There are a couple of hundred of them who have logged in from all over the world, from the US, Europe, Asia, Latin America. They are the future leaders, as I mentioned in the last year. And very happy to support you by offering free registration for the summit. It's very rare to get this profile of great people in one day, in one meeting all over the world. So please get excited, motivated, learn from these leaders, from the academics and from the industry. You're in the right industry. You're working for a very noble cause, which is a patient. So welcome to all the students where they are. On the clinical trial, Dr. Plump has taken a great initiative towards India and how we could scale up the clinical trials in India. And I must admit, this is really a golden time for India to leverage opportunities in the clinical trials space over there. A couple of things are happening, the geopolitical situation in the world, the wars which are happening, the DEI, which is diversity, inclusiveness in the clinical trials. So, and also the top leadership in India is really focused towards innovation. So I hope this is a great opportunity. We have the right set of people in the room, virtually, of course, who can take decisions and move this forward. USAIC has been involved and pushing the initiative towards the gender equity. We have made some progress. A lot of work needs to be done, but I'm glad to see a lot of our female colleagues in this group who are helping us out over there. And I must thank our sponsors. Without them, this meeting would not have been possible, starting with Amgen, Bayer, Biocon, Biogen, Johnson & Johnson, Jubilant, Medidata, Merck, Roivant Sciences, Sanofi, and Takeda. So thank you so much for that. Just a reminder, the polls will open in the beginning of each panel. So please cast your polling and the results would be announced immediately after the break of the first panel. So grab your lunch or a breakfast or a coffee, wherever you are, or a happy hour's drink. And I hand it over to our chair and EMC, Dr. Andrew Plum.